Welcome to Sir Robert Chiduk Tutorials. Learning is 24/7. Hello and welcome to Sir Robert Chiduk Tutorials, where we explore various topics in the area of nursing, that is anatomy and physiology, courses like public health nursing, courses like medical nursing, surgical nursing, integrated reproductive health, that is obstetrics and gynecology nursing, and all other critical topics. We explore them. Today we look at this question paper. Particularly, it's more of anatomy. So the question goes: the urinary system is also known as the urinary tract or the renal system, responsible for eliminating waste from the body and also to regulate the volume, blood volume and pressure. Item A, draw the structure of a nephron and label it for 15 marks. This one you are just going to check in your anatomy and then you draw. You do some erasers to make sure that you're able to draw. Make sure that you learn to draw. You do the drawings, you post them on the walls. Each time you are checking from your bed, from the foot of your bed, you can see the diagram of the eye, the diagram of a nephron, all other diagrams. B, explain the stages of urine formation for 30 marks. We're going to look at it and explain. C, mention every structure that make up the urinary system. D, explain on blood supply to the kidneys for 20 marks. E, mention any 5 conditions that would result if the urinary system was to be compromised. Okay, thanks so much. So we are going to learn more after this break. Welcome back from the break. We now look at the nephron. From our question, we ask you to draw the diagram of the nephron and to label it. So here is the diagram of the nephron and how you are supposed to label it. This is our nephron. This is our nephron. This is the nephron. I think you can clearly visualize it. You can clearly see it. This is the nephron. This is our nephron. As you can see, I think you've seen it. So what is a nephron? The nephron consists of a tube closed at one end and the other end opening into a collecting tube. The closed or the blind end is intended to form the cup-shaped glomerular capsule. So let's look at it again. I think you've seen, right? So the glomerular or the Bowman capsule, which almost completely encloses a network of tiny arterial capillaries, the glomerulus. So the glomerulus is made up of arterial capillaries. These resemble a curled tuft and are shown in figure 13.6, which you are going to see. So continuing from the glomerular capsule, the remainder of the nephron is about 3 centimeters long and is described in 3 parts. So a nephron is made by, can be described in 3 parts. We've got what we call the proximal convoluted tubule, the medullary loop or the loop of Henle, and the distal convoluted tubules, which lead into a collecting duct. So here it is. With the branch of the renal artery that you are seeing, from this branch of the renal artery that you are looking at, we have the afferent arteriole. This afferent arteriole will further divide and to form a network of arterial capillaries, which is called the glomerulus. This glomerulus is encapsulated or contained or invaginated in the Bowman capsule or the glomerular capsule. This is a cup-shaped structure which continues as a yellowish to form the proximal. It is the one that forms the same Bowman's capsule or glomerular capsule, which contains the glomerulus. When it moves along the way, it becomes the proximal convoluted tubules at the first end. Along the way, it becomes the distal convoluted tubules. And then on the other end, it becomes the medullary loop, and then the collecting duct. So what happens to the glomerulus, which is a network of arterial capillaries? Because I said the afferent arteriole is the one that further divides to form a minute network of blood vessels of arterial capillaries, which we know as the glomerulus. So these ones will combine again to form what we call the efferent arteriole. So the efferent arteriole will leave the Bowman's capsule or the glomerular capsule. So when the efferent arteriole leaves, it then forms what we call the peritubular capillaries. These are the peritubular capillaries, right? So generally this is your nephron. So you must be able to draw your nephron. You must draw your nephron. The very important diagram. Paste it on the wall as you are sleeping or as you are seated. You are looking at your diagram, and then continue practicing as well until we meet after this break. Welcome from the break. Let's look at the last stage of urine formation, and this is called tubular secretion. Filtration occurs as the blood flows through the glomerulus. Substances not required and foreign materials, for example drugs including penicillin and aspirin, may not be cleared from the blood by filtration because of the short time that it stays there. So this is the shortest stage of urine formation because of the short time that it remains in the glomerulus. Such substances are cleared by secretion from the peritubular capillaries into the convoluted tubules and excreted from the body in urine. Tubular secretion of hydrogen ions is important in maintaining normal blood pH. So this is tubular secretion. So what are we saying? We are saying there are certain substances that are not eliminated from the blood via other processes, but you can only be eliminated via tubular secretion because of the short time which they stay in the glomerulus. So these take the form of drugs like amoxicillin and aspirin. This is the reason why most of the times, even when you are urinating, you can take note of the smell of amoxicillin from your urine. So such substances are cleared by secretion from the peritubular capillaries into the convoluted tubules and excreted from the body in the urine. Tubular secretion of hydrogen ions. This one, it maintains the acid-base balance, which is the body pH. So now let us look, as we end, let us look at the summary of urine formation. The summary of urine formation. Let us look at the summary of urine formation. So summary of the urine formation is like this. Urine is formed in by three processes. Urine is formed in three stages by three processes. Summary of the three processes that form urine are like this. I think you can see the glomerular capsule there. You can see the glomerulus, which is inside the glomerular capsule. In fact, let me study it this way. You can see that red artery. That one is the branch of the renal artery which divides to form the afferent arteriole, and the afferent arteriole forms the glomerulus, which is a network of arterial blood vessels. And these arterial blood vessels called the glomerulus, they unite again and form a vessel called the efferent arteriole, which leaves the Bowman's capsule or the glomerular capsule to form the peritubular capillaries, right? And then the Bowman capsule or the glomerular capsule, at a certain point it becomes the proximal convoluted tubule. At a particular stage it becomes the convoluted tubule. At a particular level it becomes the loop of Renal. right? And also it becomes the collecting ducts which empty into the ureters. So these are the three stages where filtration, and obviously it is the blood which is being filtered, right? Filtration occurs, the blood and the nephron, right? Two, there's reabsorption. That is the filtrate to blood. Then there is secretion, blood to filtrate. So this is the summary. Capillaries of the nephron, this is the process, the collecting duct, renal vein, what. So thank you so much for your time. Also take time to go through and read, and also refer to our videos for more. Feel free to ask any questions which you may have. Welcome to our last segment, where we are going to look at urine formation of urine. Formation of urine is one of the functions of the kidneys. It is the kidneys that form the urine, and the purpose of urine formation is to eliminate body waste, the substances that are not needed in the body are supposed to be eliminated via urination. So let us look at formation of urine. So the kidneys form urine which passes through the ureters to the bladder for storage prior to the excretion. The composition of urine reflects the exchange of substances between the nephron and the blood in the renal capillaries. Waste products of protein metabolism are excreted. For example, electrolytes are also controlled, and pH acid-base balance is maintained by excretion of hydrogen ions. These are the processes involved in the formation of urine. I guess you've also seen the functions of urine. We have urine formation of urine. We have also elimination of waste products that are excreted. We have maintenance of electrolyte balance, and also water balance, and also pH balance, which is called the acid-base balance. All those are the functions of the kidneys. So let us look at urine formation. So urine formation is just refers to the processes that are involved in the formation of urine and elimination of unwanted substances from the body, and this happens in 3 stages. We have 3 stages in urine formation. We have what we call the glomerular filtration, number 1. Number 2, we have what we call the selective reabsorption. Number 3, which is the last stage, is called tubular secretion. So let us look at filtration. Filtration occurs in the glomerulus. Filtration occurs in the glomerulus. That's why we call it glomerular filtration as the first stage of urine formation. So you can see this is the glomerulus. The glomerulus, which is made up by the afferent and the efferent arteriole, and it is encapsulated in the Bowman's capsule, which you are seeing here. So you can see that there's glomerular hydrostatic pressure, which is 7.3 kilopascals. It's higher than the blood osmotic pressure, which is 4 kilopascals, and also it also greater than the capsular hydrostatic pressure of 2 kilopascals. We're going to see the importance of that. So let's delve straight into filtration. So filtration, this takes place through the semi-permeable walls of the glomerulus. So the walls of the glomerulus are semi-permeable, which means osmosis can happen, and also filtration can happen. Some molecules can pass through, right? Particularly water molecules. So this takes place through the semi-permeable walls of the glomerulus, this filtration, and the glomerular capsule. So it happens between the semi-permeable walls of the glomerulus and the glomerular capsule. This is where filtration occurs. Water and other small molecules pass through, although some are reabsorbed later. So what is going to be filtered? Water and other small molecules, they pass through the semi-permeable walls of the glomerulus, right, into the Bowman's capsule. Blood cells Plasma proteins and other larger molecules are too large to filter through and therefore remain in the capillaries. So larger molecules will not pass through the walls, the same permeable walls of the glomerulus. They remain in the blood capillaries. And what are these larger molecules? We have blood cells, we have plasma proteins, and other larger molecules which are too large to filter. So if your kidneys, if your glomerulus starts letting the blood cells and these large molecules like plasma proteins and other large molecules to pass through, then it means you are already ill. That will be a diseased glomerulus. It will be a disease on its own. So a normal glomerulus doesn't allow blood cells, it doesn't allow plasma proteins, it doesn't allow other molecules and larger molecules to filter through. Therefore, it remains in the glomerulus. The filtrate in the glomerulus is very similar in composition to plasma, with important exceptions of plasma proteins and blood cells. So filtration takes place because there's a difference between the blood in the glomerulus and the pressure of the filtrate in the glomerular capsule. So you see that the capillary hydrostatic pressure is 7.3 kilopascals, and then the blood osmotic pressure is 4 kilopascals. So that pressure difference on its own, it causes filtration to occur. Right? So because the efferent arteriole is narrower than the arteriole, so the other issue is the difference in the caliber or the size of the afferent and the efferent arteriole. The fact that the other is narrower than the other causes, it sets the pressure differences, thereby allowing the process of filtration to take place. So that's why we say, because the efferent arteriole is narrower than the afferent arteriole, a capillary hydrostatic pressure of about 7.3 kilopascals, which is 55 millimeters of mercury, builds up in the glomerulus. This pressure is opposed by osmotic pressure of blood, provided mainly by plasma proteins about 4 kilopascals, which is 30 millimeters of mercury, and by the filtrate hydrostatic pressure of about 2 kilopascals, which is 15 millimeters of mercury, in the glomerular capsule. The net filtration rate is therefore, as you can see in the diagram. So the pressure difference itself, because of the caliber of the difference, because the efferent arteriole is narrower, it causes filtration to occur. The volume of the filtrate is formed by both kidneys. Each minute is called the glomerular filtration rate, GFR. So this is the volume of filtrate which is formed by two kidneys. Each minute, I mean a minute, is called the glomerular filtration rate. In a healthy adult, the glomerular filtration rate is about 125 milliliters per minute. So in a healthy adult, 125 milliliters per minute. This equates to 180 liters of filtrate, which are formed each day by two kidneys. That is in 24 hours. Nearly all of the filtrate is later reabsorbed from the kidney tubules, with less than 1%, 1 to 1.5 liters excreted as urine. The difference in the volume and concentration are due to selective reabsorption. So that's it on filtration. There's auto-regulation of filtration. Renal blood flow is protected by a mechanism called auto-regulation, whereby renal blood flow is maintained at a constant pressure across a wide range of systolic blood pressures from around 80 to 200 millimeters of mercury. So let us look to so that was the first process of urine formation. Let us look at the second stage, which is called selective reabsorption. Maybe a summary of filtration. Summary of glomerular filtration. We said glomerular filtration occurs between the same permeable walls of the glomerulus and the glomerular capsule, right? And what are the factors that cause filtration to occur? We said the efferent arteriole is narrower than the afferent arteriole, and that causes capillary hydrostatic pressure of 7.3 kilopascals to build, as opposed to the capillary hydrostatic pressure of of about 30 millimeters of mercury, or 4 kilopascals. That on its own causes, and also the glomerular filtrate, it also causes this filtration to continue occurring. So now let us look at selective reabsorption. What happens in selective reabsorption? Most reabsorption from the filtrate back into the blood takes place in the proximal convoluted tubule. So you see that selective reabsorption, where does it happen? The site, it occurs in the proximal convoluted tubules, whose walls are lined with microvilli to increase surface area for absorption. So the convoluted tubules are lined by the microvilli. So these microvilli will provide a large surface area for absorption to occur. So you see, things are organized. The microvilli, they provide increased surface area for absorption. Materials essential to the body are reabsorbed here, including some water. So some water is going to be reabsorbed. So because your question obviously is, what is going to be reabsorbed? Definitely some water is going to be reabsorbed in order to maintain water balance. That's why we say one of the functions of the kidneys is to maintain water balance. So some water molecules are going to be reabsorbed. Electrolytes are also going to be reabsorbed. That's why we say one of the functions of the kidneys is electrolyte balance, maintaining electrolyte balance. And organic nutrients, some nutrients such as glucose, they are also going to be reabsorbed. Some reabsorption is passive, but some substances are transported actively. So reabsorption occurs passively without the use of energy, but there are certain molecules which need active transport, which are transported actively. Only 60 to 70% of filtrate reaches the loop of the nephron. Much of this is especially water, sodium and chloride. These are some of the ions which are reabsorbed. Sodium, chloride, water, and glucose is reabsorbed in the loop. So only 15 to 20% of the original filtrate reaches the distal convolution. Welcome. I know you wanted me to go straight into urine formation, explaining urine formation, but it's very important for you to have conclusive information about how the whole renal system is structured. It is critically important for you to have in-depth knowledge and full knowledge of all the concepts that are involved in the urinary system or the renal system. That is the kidneys, how the kidneys work, and other associated structures. So the learning outcomes here, after studying this section, should be able to identify the organs that are associated with the kidneys. What are some of those organs that are closely related to the kidneys in concerning how they work together with the kidneys? Outline the gross structure of the kidney. You should be able to outline the gross structure of the kidney. This is what we call the gross structure of the kidney. Describe the structure of a nephron. You must be able to draw the nephron and to label it. Explain the processes involved in the formation of urine. You must know the processes involved in the formation of urine. Explain how body water and electrolyte balance is maintained. Yes, you must know electrolyte balance and water balance. Right, let us go straight. The kidneys lie on the posterior abdominal wall. That is right at the back. That is the posterior of the abdominal wall. One on each side of the vertebral column, behind the peritoneum and below the diaphragm. Let's check and see. We can't just talk, we need to see that, right? How the kidneys are structured. Right, it's here. You see? This is what we mean. Right at the posterior of the abdominal wall, right at the back. As you can see, these are some of the kidneys, those two kidneys. I think you have seen. Okay. So they extend from the level of the 12th thoracic vertebra to the 3rd lumbar vertebra, receiving some protection from the lower rib cage. The right kidney is usually slightly lower than the left, probably because of the considerable space occupied by the liver. So the kidneys are bean-shaped organs, about 11 centimeters long, but obviously in adults. 6 centimeters wide, 3 centimeters thick, and weigh 150 grams. They are embedded in and held in position by a mass of fat. So these are some of the associated structures that we're talking about. The kidneys are not in isolation. So they are held in position, for example, by a mass of fat. So you will be able to see the fat. I will show you. A sheet of fibrous connective tissue, also known as the renal fascia, encloses the kidney and the renal fat. So let's look at the anterior view of the kidneys, showing the areas associated with the structures. The anterior, this is the front part of the kidney. That's the anterior part. The posterior part is the back part of it. So this is the anterior part. It is associated with the adrenal glands. Right on top of the kidneys, there are adrenal glands. Right? This part, you can see that just on this part, there is a duodenum. Right? On the other part, it's associated with the liver. On the other part, the spleen, the pancreas, the jejunum, the splenic flexure, the small intestine. Right? So from these kidneys emerge the ureters, which empty into the bladder. So these are the organs associated with the kidneys. So superior, which is on top with the adrenal glands. Then anterior, which is in front with the right lobe of the liver, the duodenum, and the hepatic flexure of the colon. Posteriorly, the diaphragm and the muscle of the posterior abdominal wall. This is what we are simply talking about, right? Posteriorly now, this is how it looks right at the back. These are the organs associated with the kidney. The diaphragm, the 12th rib, the right 12th rib, the inferior vena cava, the aorta, the transverse processes of the first lumbar vertebra, the left transversus abdominis muscle, the left quadratus laborium muscle, the psoas muscle, the right quadratus lumborum muscle, the right transversus abdominis muscle. So this is a longitudinal section of the right kidney. Right, let us look at this very important diagram. This diagram shows a longitudinal section of the right kidney. So this is a section of the kidney. If it is bisected, right, how it looks inside. So this is our kidney. A kidney has got these structures. The longitudinal section of a kidney, it has got the medulla. So you can see the medulla, those structures that are dark reddish in color. Those are the medulla, right, or the pyramids, medulla or pyramids. Then we've got the cortex. So you find that the medulla or the pyramids, they are right inside the cortex. We call it the renal cortex. Right in front of the pyramids, we have what we call the minor calyces. With the minor cauces. We also have the major cauces. So when it's one, it's a major caux. When there are many, it's major causes. Right? Then we have the renal artery. We also have the renal vein. We then have the ureter. So we also have what we call the renal pelvis. The renal pelvis, as you can see, the ureters now are collecting the urine and emptying into the bladder. So in simple terms, I am sure you have understood this. So I was saying the medulla is the innermost layer. You must know the layer. So the kidney has got the layers. So this is how you should understand these layers. Let me just rush through. So the medulla is the innermost layer of the kidney, which consists of pale conical shaped striations, the renal pyramids. Then we have what we call the hilum. The hilum is the concave medial border of the kidney, where the renal blood and lymph vessels, ureter, and nerves enter. Then we have the renal pelvis. The renal pelvis is the funnel shaped structure that collects urine formed by the kidney. Urine formed in the kidney passes through a renal papilla at the apex of a pyramid into a minor calci, then into a major calci before passing through the renal pelvis into the ureter. The walls of the pelvis contain smooth muscle and are lined with transitional epithelium. I'm sure you did the tissues. So we are done with the structure with the longitudinal section of the kidney. This is the longitudinal section of the kidney. You must master this diagram. Make sure you draw it. You draw it and you post it on your wall in your room. Each time when you're sleeping on your bed, when you're resting, you're looking at the diagram to visualize and understand the structures. Let's meet again after this break.